In this video, I'm going to go over everything you need to know about plantar fasciitis, from the cause of the problem, to the symptoms you might be having, to the anatomy that's involved, and then I'll go over 3 exercises that, if you have plantar fasciitis, could get you out of symptoms and on the way to recovery. Let's go. Okay, so today we are talking about plantar fasciitis. And if you arrived to this video from the previous case study with Martina, or the interview with Martina, just understand that the injury that she sustained was not plantar fasciitis. Very, very different than something you might be experiencing, different in terms of pain and mechanism of injury. If you haven't seen that interview, it's actually quite fascinating. It's just kind of a different spin on an injury to the plantar fascia. I'll put the link up here if you want to check that out after this. But let's talk about plantar fasciitis today. First things first, let's talk about what is the plantar fascia in the first place. Well, the plantar fascia is just a very thick, fibrous band of connective tissue that lives on the bottom of your foot. So it attaches to the calcaneus, or the heel bone, and then kind of in a triangular pattern spans out towards the forefoot and attaches to all of your toes, essentially. And what it does is basically it provides you with a little bit of arch integrity of the arch. It also, because it's so thick, it helps to support the foot in general, especially with walking, and it protects a lot of the nerves and blood vessels and muscles underneath it. So it's a very important and dynamic connective tissue structure in your body that unfortunately can get injured from time to time. So the symptoms of plantar fasciitis, the very hallmark pain is the first step out of bed in the morning. So if you are waking up and you step out of bed and it's the first thing you feel is that very sharp, excruciating pain, typically in the heel itself, good chance you've got plantar fasciitis. If you're standing and walking all day long, or even if you're sitting at a desk and the first thing you do to stand up and walk and you have that reproducible pain, good chance that we're dealing with a plantar fasciitis problem here. Now, as the name implies, basically what it is inflammation to that plantar fascia. Now, how did you get this? Well, it's kind of an insidious onset. It's not something where you trip down the stairs and all of a sudden you've got plantar fasciitis. It kind of comes with time, and there's a lot of different reasons why that may have developed in your foot. For some people, it's just a case of bad footwear. Maybe it's old footwear. Maybe it's not providing you with arch support, and we'll talk about that a little bit later. Maybe it's that you're a runner and you're doing a lot of distance running. Look, back in my distance running days, this is something I was quite familiar with, unfortunately. So it could just be adding a lot of miles to your running routine that could be stressing out the plantar fascia and causing problems. Obesity, if you're overweight and you're carrying, extra lbs, that can cause increased tissue stress on the plantar fascia. And pes planus, or flat foot, if you notice that your foot is flat, a little bit of the chicken and the egg here. Basically, you have something called the spring ligament that also helps to preserve the arch. In the case of a flat foot, that has collapsed. The spring ligament has failed, basically, and now you're in a flat-footed position, which causes increased tissue stress on that plantar fascia. Now, with a flat foot, I understand that structurally, some of us are just born that way, but more times than not, from what I've seen, is it's actually something that has developed over time, and it's usually a result of, well, like I said, it could be extra lbs, so a little bit of extra weight could be causing the extra stress and for that foot to collapse. But it also could be a muscle imbalance where you have a weakness of some of the smaller muscles in the bottom of the foot, and the posterior tibialis, which also is a muscle little higher in the calf or lower leg region that wraps down and attaches to virtually every bone in the bottom of the foot. So that if that's weak, that will reduce the integrity of that arch and cause that flat-footedness. So in a clinical setting, what we would do is take a look at the strength of some of these muscles and see if they could be contributing to the plantar fascia. And in fact, this is how we're going to tackle this in a couple more minutes in the video. I'm going to show you some exercises that you can do to actually improve the flexibility and mobility of the foot and increase the strength of the muscles that may be a little bit weak. So stay tuned. I've got you covered with all those exercises that you can start today to get back on the road to recovery. Now, we're going to attack this from a physical standpoint because I'm a physical therapist, but I do want to mention that there are a lot of other different types of things that you could be doing behaviorally to your body, which could cause plantar fasciitis or could, continue to propagate the symptoms if you're not paying attention to them. Psychological and emotional stress is a big one. Some of these pathways aren't fully understood, but there's certainly this clinical relevance to it. Eating foods that are inflammatory could also cause those problems. We mentioned footwear, so taking a look at your footwear, making sure it's appropriate. And again, also the obesity factor. If we could kind of reduce some of the pounds, we could reduce the amount of stress that we're putting on our joints and our plantar fascia. Right, so in addition to the physical changes that we can make with the mobility, the flexibility, and the strength coming in just a moment, other things that you can do to relieve the symptoms that you may be having right now, you could take some NSAIDs, some non-steroidal anti-inflammatories like Motrin, like Advil, like Aleve, that will get some of that inflammation out of there and kind of make it a little less painful condition. It's not going to solve the problem, but it's going to get you through the day with a little less pain. Also, as an anti-inflammatory tool, what you can do is ice the bottom of the foot. The best way to do this is to take a water bottle, put it in the freezer, and then when it comes out, now you can roll on the bottom of the foot. So you get a little bit of a myofascial release, or we're trying to relieve some of the pressure just by exerting some weight onto that cylindrical bottle. But you're also getting the icing component, which is an anti-inflammatory as well. Other things are, should go without saying, but try to avoid those activities which are exacerbating the symptoms. So if it is a running problem, reduce the miles for a while. Let's get this injury, this pain under control before you go out and really start attacking the training again. And then finally, there are night splints. There are some splints that you can wear at night to try to help kind of passively improve the flexibility and reduce the tissue stress. That is to me feels like a little bit of a nuclear option. I've actually done that, and it's quite uncomfortable, to the point where I was losing sleep because of the discomfort of that night splint. So you got to kind of weigh that out. If you're losing sleep, that may be impairing some of the pain pathways as well. So that's just an option to consider. So we've gone over all of the anatomy, the potential problems or causes of plantar fasciitis, some possible solutions. Now let's really get into the meat of the physical therapy. So stay with me. We've got 3 exercises that you can start today to start to reduce some of the symptoms that you're having in your foot. Here we go. This is by no means meant to be a comprehensive treatment plan for your plantar fasciitis. If I was told that I only had 3 exercises to give to you to get started on the process of recovery for your foot, I would give you these 3 exercises. But remember that these are just the start. And what you really want to do is get through these first 3 exercises and then continue to progress to get back into the hobbies and the lifestyle that unfortunately your symptoms aren't able to allow you to do right now. So start with these 3 and then we can go from there. So the very first one, what we're going to do is increase the mobility of this joint right here. It's called the first MTP or first metatarsophalangeal joint. It's the joint for the big toe. And when the plantar fascia becomes so tight and bound down, this joint is subsequently going to get tight. And it's kind of the chicken and the egg issue here too. Sometimes if this joint doesn't have the mobility, your foot is not going to walk with the normal mechanics, and that could also be a cause of plantar fasciitis. So what we're going to do is improve the mobility of this joint, and that's actually going to affect the extensibility of the fascia itself. So to do this stretch, what we're going to do is take one hand and you're going to stabilize right here in the forefoot, grabbing onto that big bone and stabilizing it there. With your other hand, you're going to take and hold on to this first kind of segment of the great toe, or the big toe. You're going to grab it and then you're going to pull out. You're going to distract, we call it, away from the foot. And then you're going to lift up this direction, up towards your shin. Okay, so we're taking that joint, taking that big toe, moving it out, and then taking it up into dorsiflexion, we call it, which is this direction here. You're going to feel that stretch in the bottom of your foot. That's the fascia that's actually stretching. You also might feel a little bit of pain right across the top, or pinching, I guess, maybe not pain per se, and that is just the joint restriction itself. If you feel a lot of those symptoms, that pinching sensation, really pull out and then lift up. So kind of this arcing motion. Try that stretch, and you're going to hold that stretch for 5 seconds. I like to do it 10 times. Take a break after 10, and then do a second set of 10. This is first MTP extension, extensibility stretch. The next stretch, what we're going to do, let me move this chair out of the way. The next stretch we're going to do is for increasing the extensibility of these muscles here in your calf. So the calf basically is made up of the gastrocnemius and the soleus muscle, which lies deep to that gastroc. Both of them come down and insert here at the Achilles tendon, which in turn inserts into the calcaneus bone here. And when you have plantar fasciitis, you tend to have tightness in the calf there. So what we're going to do is line up to a wall. Okay, you're going to plant that heel down into the ground. Don't let the heel come up. You need to keep that planted down this way. And you're just going to lean into the wall until you feel a nice stretch in the back of your leg here. From here, now what you're going to do is bend the knee, making sure that heel stays down. Bend the knee and don't let the knee roll in. It's going to want to roll in, and that will flatten your arch. You need to maintain that knee in alignment with your ankle and your foot. That'll preserve the arch, and you'll feel that nice stretch low, maybe into the Achilles and into the calf. Hold stretches for 20 seconds, and you might as well do both sides. So you're going to do each side 2 times with this stretch. It's always fun to compare the 2 sides to see if one side is tighter than the other, and it's no coincidence that you'll usually find the side with the plantar fasciitis tends to be a little bit tighter. Good. So now we've increased the mobility of that big toe joint, and we've increased the flexibility of the calf muscles. So now what we want to do is actually strengthen some of the muscles in the bottom of the foot to help support the arch, help maintain that arch. And if your foot is flat, it's kind of like this flattened foot, these muscles are going to be really weak. So these are muscles that aren't used to working. So you're going to feel this maybe a little bit of cramping sensation, which is totally normal with this exercise. So let me bring the chair back. You can do this sitting. And when I was in a clinical setting, I used to actually take thumbtacks and put them underneath people's feet. I was super mean PT. I couldn't find any thumbtacks in the house today, so what I did find was a dice. This would work. Don't ask. Go to your everything drawer in the kitchen, pull out something that's small like this, chapstick, tube, something like that. So what you're going to do is when you find your object, a marble would work really well, or a thumbtack if you have one of those laying around the house. You're going to take your little object and you're going to put it right in your arch here. Okay, I'll sit this way so you can see it a little bit better. So from here, now what you're going to do is you have your little marble, your little object pressing into your arch. It's just a little bit of biofeedback to remind your skin and your foot that there's something under there. So what we want to do, the exercise here then, is to lift that arch up off of that object. So from here, it's a really subtle movement, and you want to think about just bringing your forefoot up towards your heel. So you're kind of shortening the length of your foot, kind of squishing up, but lifting that arch up off, in this case, the dice. I'm going to hold that contraction for 5 seconds and then relax. And then when you relax, you're going to see that arch kind of collapses down. You're going to feel more pressure on whatever object you've stuck underneath your foot. So let's do this again. So from here, I'm going to pull my arch up, contracting those deep muscles on the bottom of the foot, taking the pressure off of my dice, and then relax it back down. So as you're doing this exercise, I'm going to do it again. As you're doing this exercise, you want to make sure that you're not gripping with your toes. The common problem is people will grip with their toes. And in that case, what we're doing now is using some long toe flexors that originate up higher in the calf area. Instead, what we're wanting to do is just focus on the muscles in the bottom of the foot, these little tiny muscles that reside there to help support the arch. Are much more efficient at doing that. So I like to do this, hold it for 5 seconds. Again, do it 10 times, 2 sets of 10. And if you really want to take this to the next level, you can actually stand up and do it. So you're putting a little bit more weight on it, so a little bit harder to do. And then really next level, when you're ready to progress, you can try this standing on one leg and lifting that arch up. Okay, so just one more demonstration. If this was my foot here, what you're doing is just trying to elevate the arch like that. So you're not gripping with the toes, you're just elevating up this way. All right, so those are 3 exercises that you can start today to start to reduce the symptoms you're having with plantar fasciitis. Good luck. If you have any issues, let me know. Hopefully I can help you out. Thank you so much for watching this video. I really hope you found it helpful, and I hope that you're feeling better already. Hey, look, do me a favor. If you felt like this was beneficial for you, please hit the like and subscribe button. What that'll do is increase the audience, so people who might be suffering from plantar fasciitis like yourself could benefit from this video. I really appreciate it. Anyway, until next time.